Hello, everybody. Welcome. I'm Sergeant Beach Larson. Just call me Steve. Painting for PTSD podcast, episode 9, talking about pain management issues. Pain management. Anybody that's been through the slightest to the not slightest, they have to deal with pain management. They have to deal with doctors that want to prescribe medicine, spinal stimulators. They're sometimes really quick to jump on board with devices, implants, non-invasive. Non-invasive. Well, it is invasive. Pain management. Let's see, how can we start this off in a sentence? And I'm joined here by my wife, who has CRPS, complex regional pain syndrome, for how long?
15
Since
years.
2009. And that started with the injury walking on the treadmill, doing some incline, being on the treadmill, and then went to the doctor with foot pain, and the doctor said, gave you shots for plantar fasciitis.
No, it was tendonitis.
Tendonitis first.
Yes.
Podiatrist. Here's a shot for tendonitis. Here's a shot for tendonitis. And it was the anti-inflammatory pain,
Cortisone.
non-dissolvable shots. And this started back in 2009.
It was 13 shots in 11 weeks.
Ended up with 13 shots in 11 weeks. Does that sound like responsible pain management at all? This one here, not popping up on the live. I'm just switching accounts here. So, anybody to talk about pain management? From minor pain to major pain. After the shots, they did a cryoablation. And this started in February. So then by June, and the podiatrist, the other doctor in the group, said, oh, we can do this cryoablation. And the cryoablation was like a pencil shoved in the plantar fascia area to numb it. And numb it, well,
Nope.
the results of that wasn't exactly numbing.
It's damaged.
It caused damage to the plantar fascia area. So at that point, went to get a second opinion. Went to see another podiatrist who claimed to be an expert and podiatrist to the Cincinnati Bengals, which was incorrect because he had only actually treated one patient. And here we go. We got some stuff going on here. Wanted to do a surgery, and we're talking about pain management here. Thanks everybody for joining. If you wouldn't mind helping out, I'm talking with my wife who has complex regional pain syndrome, CRPS. So she's had this for 15 years. We're going to talk a little bit about the treatment process she's been through. But please share your experience with pain management. Just, short sentence, comment. You have this, fibromyalgia, other issues with pain management, bones, muscles. Mention something about your treatment. What did they try and do really quick? What worked for you? What didn't work? What was obvious failure? I'm trying just to hit a button here. Thanks for joining there, Jonesy145. It sounds tough. Oh, hang on, Jonesy. This story is going to blow your mind. So, this starts in February. We go through the 13 shots in 11 weeks, the two guys in one podiatry group. And by the way, we hate podiatrists. They're not doctors.
Yeah, don't go to a podiatrist.
Podiatrists, they're not. Go to a doctor, make sure they got the MD behind their name, real MD. Then she gets cryoablation in June. Get a second opinion in August. And to the doctor's podiatrist who says he's great. He did have one Bengal come in, probably had a little wart on his toe removed, and then he made it out like he was the team doctor. Anyhow, sent her to pain management prior to doing a surgery. And he wanted to do a plantar fascia release. And that was the only thing he planned on doing, correct? Mm-hmm. So she goes to the pain management, And she's having a big flare up from her CRPS right now, by the way. She's probably not going to be on camera tonight. You're going to hear her voice. Make sure the volume's up really good. And hi, Bentley. Thanks for joining. And goes to pain management, who says she has beginning stages of RSD, reflex sympathetic dystrophy. RSD is like the stage 1. When you start to get nerve symptoms, you start to have the feeling of hot and cold.
And
Really
don't forget,
sensitivity, purplish.
I went to 96.
Oh, we're getting to that.
Okay.
So this pain doctor says, thank you for subscribing there, Bentley. We talk about a lot of things on this podcast, Painting for PTSD. And it's not just about talking. Let me tell you this right before I'll get you up to the surgery. He says he does not recommend surgery. He recommends putting her on nerve medication to calm the nerves, anti-inflammatory, and back off with surgery. Well, you know what happens with doctors when it becomes the end of the year? And we do have friends that are doctors, not all are bad, but this podiatrist clearly wanted to get a surgery in before the end of the year to have another one on the books. So even though the neurologist said don't, we scheduled it. She had respiratory infection, coughing. The doctor's like, well, call me as soon as she's done. 2 weeks later, we called like, hey, she's not coughing. Okay, can you come in? It was like 3 days from then. Like, let's rush. We got to make sure we got surgery. Unbelievable. So before I tell you about the surgery that was not plantar fascia release, painting for PTSD. I finally realized a year and a half ago at age 56, I have PTSD. I'm former military, retired police, 2 SWAT teams. I worked in a prison. I've been around a lot of bad things and death. I've written 2 books, very exciting. They're on Amazon. I'll tell you about them later. But the podcast is called Painting for PTSD. You know, the Beast shirt. And my wife is the best wife. Next week, 30-year anniversary. I have several shirts say Beast on them. Selena, hi. Thanks for joining. Painting for PTSD is taking and putting a gun and a weapon down that I've carried for 30 years and doing something else, painting. Always wanted to paint, never painted. Well, I got one of these things where you picture like this. I got in a clearance aisle at Michael's hobby store. And you get this, there's no numbers, look at the picture and you paint. Well, from this, I did this. This is my first painting, folks. And you know what? It was very therapeutic. I sat down, look at this up here, the blending. And my wife over here kind of gave me a hint about, light and dark. But I blended, I changed colors. And I made this. I made this water. I made this village. Coincidentally, it does look like the Equalizer scene over there in Italy. Equalizer Part 3. And Greece as well. But you remember in Equalizer, Denzel's over there, and after he gets shot and goes to the village. But this podcast is a chance for people to get on and talk because, people have different names on their Gmail. They have fake names, Big Daddy 448, all this kind of stuff. Everybody says things, and they just share experiences having PTSD. And it's not just war. It's not just war. My wife has not been in a war. My wife has not been in violence. Streak Lord, welcome. How you doing? Y'all on here. I'm from Kentucky, not Pennsylvania. But if you wouldn't mind, share an experience with pain management, a success or a struggle or a problem. For instance, the neighbor across the street worked on his car, his Mustang. Just shortly, he had an incident, had an injury, had a shoulder surgery, and got addicted to the Oxycontin, ran out for prescriptions, started buying on the street. And then he realized after doing this, like, hey, this is bad. I shouldn't be doing this. I need to get off. That's his story. That's our neighbor across the street. Great dude. Got a little girl's, about 2 years old?
Yeah.
Wife's always saying hi out the window to her. But I painted this. Trying to get away from violence, trying to understand. If you go back into episodes, I've talked about accepting this, admitting things. I talked about signs I missed that she knew all along. Anyhow, this is an option. One of the episodes, my daughter got certified in microblading, And her final exam was to give my wife permanent tattooed eyebrows and lips. And that's an outlet for her. Tattooing is an outlet. Carpentry is an outlet. Things that people do. You ever notice, and I say this every episode, a lot of veterans get into construction because it's building, it's loud noise, it's things that replace what they're seeing and hearing. So this is my claim to fame, first picture. Very proud of this. It's going to go on a wall here shortly. But anyhow, so we get up to her foot surgery. So now all of a sudden we've got pain doctor says, hey, this is beginning stage of RSD. And then we've got the podiatrist saying, due to surgery, due to surgery. He's all excited, fingers right there. Senior high school, smoking weed all day, was alone. Yeah, we had COVID. I'll tell you about COVID. We both almost, yeah, COVID was a thing. Street Lord, she's with us. She actually, heart stopped. They had to shock her in COVID. She was in the ICU. I was almost died on the couch at home. What's your head bobbing for? I'm going to have to step in the other room here. I'll show you why. I need to let this fella, he's over here head bobbing, noggin. He's telling me he needs to go outside. So here we go. We'll take this over here. But we almost died of COVID. It was unbelievable. Come on, buddy. Run outside. I know. Okay. So we're getting back to our surgery story. So we weigh the options. The foot doctor's like, you got to have this release. It's simple. Just go in, thin out the layer in your foot, the plantar fascial release. People do releases of things all the time. And we're like, okay, so she decided to go ahead and do it. Gets it in there, does a plantar fascial release, comes out, tells me she's doing good. Tim Conjure, hey, welcome. In a car accident, got strung out on oxy, ended up robbing the Walgreens for pills.
Oh, no.
That's sad. I got a story like that too, Tim. Hang on a second. So you do this plantar fascia release. The doctor comes out, podiatrist. I don't want to call him doctor anymore.
No.
And he does a plantar fascia release. He does a carpal tunnel release. He said, oh, she had her tarsal tunnel on the foot. He released the tarsal tunnel, the other ligament there on the side. And what else happened?
I got foot drop.
And then she ends up with foot drop, where instead of her foot walking and being normal, her foot just went like this because of his surgery. And we're just like,
holy crap.
holy crap. Got the bug eyes out. I was like, mad. I got a career in protecting people, but I'm also trained how to kill people, but I didn't kill him. I was mad. This gets worse. We get out, he looks at it. So when you have a procedure, they're always looking, for infection, stuff like that. Your basic procedure, it healed, no infection, nothing crazy. Didn't have an extra toe grow out or anything. He's like, okay, we're going to go to physical therapy. Sends her to physical therapy. Now, if you go back, thank you for all the hearts and stuff there, folks. Thanks for joining. She goes to physical therapy. Let's see, how did that start? Oh, you got foot drop. Let's try and bring it up. So they start trying to bring it up, start pushing, start trying to bring it up.
Yep, nope.
Let's do stem cell, whatever this stuff shocks. They're trying to shock. Put it on there. Oh, let's stimulate the nerves electricity-wise.
Oh,
so now they're shocking her foot. She ends up running to the bathroom. She's throwing up. Oh, we better stop therapy. So here we go. Let's try it again. 3 times. We go to the doctor. Well, you're making progress. We're making progress. Just bear with us there, Sean. And that's her name. And we'll get through this. So she's throwing up. They're shocking her. We're getting really mad. I'm fixing the Tasmanian devil everybody in here. And after 96 visits, she stops. She's like, we got to stop going. We go back to the doctor. And sometime in there, he sends her to a nerve guy to do a nerve test. Well, let's make sure her foot with the foot drops actually alive. So she goes to this nerve dude. I'll call him a dude. He's a doctor, but he's a real sorry POS suck ass piece of shoot. He does this test, and I say all this so negatively. You know what? He never even billed our insurance.
Nope.
And when you go do an EMG, it costs more than $0. never billed the insurance. He did this as a slick political favor to his podiatrist buddy. So then after this test, she goes back to this foot doctor, podiatry dude. And he's like, oh, you're fine. I don't need to see you anymore. You're discharged. He discharged her.
Yeah. Yeah.
And then we're just like, what do we do? So I'm looking around. Now she's got foot drop. We're like panic and chaos. So we end up going up to the Dellin Institute at Johns Hopkins. We drive up through Pennsylvania and everything, beautiful country, go up there. And we got to pay this doctor $1,200 in cash up front, $600 for his test, $600 for the office visit. And this guy was older than us, and he's just sitting down on the chair, and he just looked at her and he started crying, just tears out of his eyes. Sean, I cannot help you with this nerve disease. And he explained this nerve disease. And it was just, I don't even know what the words to describe.
Oh no, but his wife ended up calling and checking on me since they couldn't help me.
Where did this go here? Uh-oh, I'm losing my punch here.
Is there a reason that you didn't report her daughter missing?
She went here. We didn't know. She doesn't live here anymore.
She was 17.
I'm looking over here on the computer trying to click a button. Here we go.
She's
So, thank you there, Nicole. Unbelievable. He's crying. His wife calls a check. He did give one hope. He said, with the nerve disease, you've got to get to see somebody and get some treatment. He said, do not do physical therapy. That is wrong. Do not take certain medications that they were trying. That is wrong. No more release, no more surgeries. That is wrong because surgery can spread it. And he said, as far as the foot drop, you're in an area, he said, there's a doctor in Cincinnati that is unbelievable that can help you with foot drop. He's the guy that if you get ran over by a semi on the interstate, he's the one that'll help fix you. So we go back home. We find this doctor, Archdeacon, over there at UC in Cincinnati, University of Cincinnati Hospital. Get in, see him, get scheduled. He's one of those guys, you know, he's a professor. He's the head of the department. He's the head of this. He has all this hardware that comes in that he's a representative for, all these paychecks, you know, $1 million plus kind of doctor. You know, I looked him up. And, but he's the top dude. Like, hey, I need my wife's foot fixed back. And because if it didn't get fixed back, here's the alternative. He sent us to his prosthetic guy. We already had her foot measured. They were going to cut her right below the knee, amputate, and we already had this prosthetic, this bionic prosthetic set up for it. $40,000 foot. So he's like, I'm going to go into surgery. I'm going to try it. We'll see if this works, if I can get this up a little bit or not. But he was going to cut the Achilles tendon in the back to release and allow it to be forced up and then put a fixator on. So here we go, pain management we're talking about. Pain management, folks. It doesn't sound like we're managing any pain. It sounds like so far we're just creating pain, which is kind of really what happened so far. All these shots created more pain than relief. Cryoablation, more pain than relief. Surgery, more pain than relief. 96 physical therapy visits, folks. Unbelievable. Unbelievable. So she goes in and she does this surgery here. And by the way, let me tell you, I'm very proud of this woman. Because let me tell you this right now, and I'll tell you this again and tell you why. She has faith, total faith in God, and puts everything in God's hands. Up to this point and going through a car wreck, previous damage to the spine and stuff, not pain medicine, not addicted to medicine, not drinking, not mixing things. Always just believing, putting her hand on the Bible and praying and believing. Faith. We go into the surgery. Doctor knows I'm a police officer at this time. I'm active. So he knows I've been around a lot of bad stuff. We talked. And before she went into surgery, you know, I'm like, honey, and we were watching that TV show. Ghost Whisperer.
Yes. Yes.
And I was like, honey, if you see the light, don't go into the light. I know it's selfish of me, but I'm not ready to lose you. This is going to be a major surgery. The doctor said, I got to do a lot of stuff. It's going to be complicated. And it could end up in an amputation or not, or a fixator, one of the two. He said, if it's really bad, I'm going to back out and nothing's going to happen. That's plan C. And he said, it's going to be, 4, 5, 6 hour surgery. It's going to be long. So he takes her back. I'm like, honey, I love you. Don't go in the light. Come back. Don't go. And surgery goes by. I'm sitting there waiting. And, here's the other half of pain management. When you're helping somebody dealing and you have no pain, how do I manage anxiety and nothing? I don't know. I just prayed a lot. And then I was like, she's going to be okay. She's tough. She's strong. Believe. See the word behind me right here? Believe. Faith and believe. In the other room where I do podcasts, it has the word faith on the wall. I'm just going to leave the camera like this for a minute because I believed in my wife and I believed in the doctor. I believed God was going to have his hand in all of this. He comes out with a scared look on his face, and I was like, is she okay? And he said, we lost her. We brought her back, but we lost her. She went into the light. He said it was just doing surgery and then it's it. Just flatline. That was it. And she was gone. They shocked her and they brought her back. Now, here's the great part of the story here, everybody. And thanks for being here to listen to this. This great part of the story. This fantastic woman, you can just see her feet right here. She don't want to be on.
No,
That's her bad foot right here. This is the one all these surgeries happen to, right there. You can see that right there. During this surgery, she did go into the light. She did go see Jesus. She touched his robe. Magnificent story. Just the smile on her face right now. She's in a lot of pain today. She just smiles. She saw Jesus touch his robe, and he said, Sean, I'm not ready for you yet. And then she came back, woke up, and there she is, and doctors are on. Had shocked her and brought her back. Incredible story. That's the greatest part of this story about this surgery in this foot is she saw Jesus. She comes out of surgery. They put her in this ICU. They give her ketamine. They keep her pretty much on the ketamine. What else did they have you on?
Methadone and morphine.
The ketamine drip through the IV, and then they were doing methadone and morphine through the IV for 4 days, just to really give a chance to reset, help deal with pain. She came out of that, came home. They sent you home with methadone and morphine.
Yes.
Both. And we had to go to family doctor for checkup. She turned to medicine and she said, I don't want it. I don't need it. I laid my hands on my leg and I prayed. I'm doing this without pain medicine. And she's got a fixator on, rods and cage sticking out. Looks like, a transformer foot.
Yep.
And that's what we joked about. Transformer. And then with the little kids, we joked about her foot got in trouble. And because I was a police, her foot's in jail. We tell kids her foot's in jail. Gotta come to the door and let the dog in. Come on, buddy. All right. Good job, buddy. Good job. Let me show you. That's a happy face. What? You want your bone? You want it? That's what. Yeah, man. There comes little Junior. Okay. Let me find your bone. There's Elvis back there, the little 18-year-old. Okay, let me put my hand down here. So she comes out of this. She comes home, no pain medicine. She said, I'm going to deal with this on my own. And she did. She dealt with this with no pain medicine. Obviously, no more physical therapy, no pain medicine, just healing. Fixator is supposed to be on for how long? 5 weeks?
Yeah.
7 weeks?
4 weeks. 4 to 5 weeks.
And it didn't. It stayed on for 9 weeks to make sure to try and get this foot to stay up. Unbelievable.
I still have foot drop though.
It brought it up, but she still has some foot drop. Her foot doesn't move. It's just stuck like this. She walks unevenly, puts extra pressure on the other side, the hip and everything. Nala, we got an extra critter over there. He's right overhead. There she comes. She's over there just getting in somebody's business. The pets here, they like to be on camera for some reason.
But the pain management department sucks.
So after that, with no medicine, then there's, okay, Sean, you're going to deal with it. Okay, you're praying, that's great. Okay. And then a little bit later, they're like, well, we should put a stimulator in there. That'll help with your pain.
Oh,
We did some research on the stimulators. Really didn't like the fact of going in, inserting that in there with the batteries, having to change it, hoping that it works. And then also, there's several people that had stimulators, you know, and nerves and the tissues, everything kind of get there and attach and surround it, and just didn't like that.
well, I read on it and it had horrible stories.
Yeah, horrible stories, reviews got bad, so never did a stimulator.
It was just scary for me.
So, not doing a stimulator. Keep on going, keep on going. We get figured out, we get to a doctor up in Cleveland, Ohio. We're like, hey, somebody referred us to Cleveland Clinic. They said, well, there's a doctor, you know, the podiatrist up there, you know, guy with great reviews, 5-star plus. So we go up and see him. He's like, I'm sorry, but you go see Dr. Hayek at University in downtown Cleveland. We go to see him and he explains there's these ketamine infusions and talks about what it is and realize, hey, you know, this is it. Pain medicine isn't for you. It's not going to work for this. So he puts her on Galeese, which is a stronger, better than gabapentin in the family.
Yeah.
Time release and better absorption. So we get onto that and get set up and start doing ketamine infusion once a month. So we're driving up there and back. We drive up early in the morning. You know, I was young, I could do it back then. You know, leave at 2 o'clock, get up there, do this infusion all day, and then come back. And that seemed to help her. It was designed to reset the nerves and kind of just numb it. You know, every month, you know, kind of like on the calendar, every month. And it would last about 3 weeks, and then that 4th week would be rough. Did it take away the pain? No, absolutely not. Did it get her back to ground zero? Was she out ready to walk up or down the street? Absolutely not. But it helped a little bit. So we're doing that. We ended up moving down south. Our daughter went to college. And, you know, we had checked, and the Shepherd Center down in Atlanta, Georgia, did the exact same thing, Dr. Shaw. So we would go down, drive a couple hours there. And he continued this ketamine. And actually, he was very good friends with Dr. Hyatt. They both were, you know, in touch. They would go to Vegas on a business convention. Yeah. But they were good friends enough that they worked together. So we kind of felt like for us, that option was maintaining. And, you know, it was enough, and we started to have grandbabies, and that was helping. During that time, they wanted to have something for like breakthrough pain, but he didn't do that. And she went in Chattanooga, Tennessee to a local pain management. And for a little while, he had I can't even think what that patch was called.
Fentanyl patch.
A fentanyl patch, and then tramadol. And that with the ketamine seemed to be a really good fix as far as pain, to like lower it from the 10 to the 9 to the 8. Sometimes maybe a 7. But for her to be in a 7 and an 8 with this nerve disease, now this nerve disease is called the suicide disease, fire and ice. Everything's either hot, burning hot, you know, nerves, hands, you know, feet, just, or it's ice cold. And her foot, we watched it go up her foot, up her ankle, up almost to her knee. Here we go. We got celebrity here. This celebrity Klaus. Sometimes he makes videos. He's called Barney Fife when he's chasing the kittens around. There you go. You can look. He does. He acts like Barney Fife when looking around. I got one video. It's called I'm Looking for My Bullet, because he's just like running around like one of the kittens took something of his and he's trying to find it. But he's my buddy. He's my buddy, right? Yeah. So we're doing this pain management with him, And then all of a sudden, we find out he's not doing this, and they shut the center down just like that, cold turkey, blam. And he and somebody else, I think it was one other person, they owned 13 pain management centers around Tennessee, Alabama, and Arkansas. And come to find out, he and this elderly lady in Social Security were billing Medicare for fraudulent equipment and services.
It wasn't Dr. Shaw that did that.
No, it was the doctor in Chattanooga
Uh-huh.
in this pain center.
Right.
Yeah, the pain center in Chattanooga. I don't even know what it was called.
I don't either. I don't remember.
Tennessee Pain Management, something like that. Anyhow, this doctor gets indicted federally, him and this lady, because now if you are pain management and you co-own 13 pain management centers, don't you have enough money? You don't have to steal from Medicare, but he did. And guess what? All over. We just had a heart doctor in Kentucky 3 months ago. These two heart doctors got indicted for doing the same thing. Embezzling money. Come on, docs. When you're making $750,000 $1 million a year, why do you got to steal? Why do you got to fraudulently bill stuff so you can get extra money? You don't deserve it. Right? Say no. No.
Right.
Yeah, I got him over here.
No.
So here's a problem with pain management. So please make some comments, folks, and tell me, have you ever been to the doctor and you're getting treatment for something and all of a sudden greed?
Stop it.
Yes, Tim, it is greed. They just absolutely shut down. So now all of a sudden she has no tramadol and she has no fentanyl patch. And here's the problem with those opioid products, you know,
They didn't bother me though.
they didn't bother, but the opioids tend to cause constipation in people as other certain medications do. Some antidepressants, you know, they've got their side effects, nausea, constipation, or diarrhea. These things tend to flow. So you're dealing with, do I deal with this patch? Do I deal with this pill? It's helping with this. I'm having some life. Everything shut down. Well, problem number 3 is certain medications you can't just absolutely stop cold turkey. And when they shut down your pain office, you're stopping cold turkey. So we have been through that. She has lived through that. Let's backtrack to her foot. Let's go full circle and go right back to her foot. Guess what with her foot? We got somebody else. When we get up to the Dellin Institute, after these shots, after this surgery, that was supposed to be a plantar fascia release, and they did tarsal tunnel release. She ends up in foot drop. We get up to a doctor, and he says, I read the notes. There was no need for tarsal tunnel release. And what he did that caused foot drop was unnecessary. So we end up in a malpractice. We get other doctors, we get other opinion. They say, yes, this was wrong, XYZ wrong. Get an attorney, file a lawsuit against the 2 doctors that did 13 shots in 11 weeks and against the doctor that said he was the Bengals foot doctor and he was going to save a day. And he did illegal surgery. When there's no sign, and I forget how they explain this medically, no tarsal tunnel sign, then it's not acceptable to do the surgery. So we end up in this lawsuit that lasts 7-8 years long, don't we?
Yep.
Unbelievable. So now we're dealing with this. We've got expert opinion. We've got an attorney. He got some experience with this nerve disease, with nerve stuff, fibromyalgia, similar. Shh. You don't have anything wrong with you, Zeus. Just lay there. No, you can't be in my lap. He's 120 pounds, the big one. He can't lay on my lap while I'm on here. So we go through this lawsuit. We're dealing with this. We're still doing the ketamine at the Shepherd Center. Dr. Shaw, great doctor. Great experience, great staff. Really care about the people once a month. Then we move back up to Kentucky, where we're from. My mom's got dementia real bad. Her mom had cancer, lung cancer stuff that was treated and some removed successfully and doing very well. So we're here up with my family. We go back up, connect with Dr. Hayek in Ohio, start doing ketamine. All of a sudden he stops. COVID, we don't have staffing. We don't have nurses. Can't do it anymore. Shut down. Man, when you're doing this ketamine, which is the one thing, besides her faith and her belief in God, Stopping this ketamine was the worst thing for her. Now all of a sudden, and it wasn't like the nausea and stopping the medicine, it was, we're back to extreme pain. This is pain management problems. Come on, people, tell me what's going on. Tim, I'll throw this to the officer. We've had friends. We had a friend, Danny, on the police. Got out of police, got injured. Always said he'd do steroids when he got out of police. He did, tore his shoulder up. Shoulder surgery. Oxy, got hooked. Ended up going to the methadone clinic. Ended up buying stuff. He actually became a professor for Gateway College. He had his degree. He was going through getting his master's for free. Teaching law enforcement. Hooked on heroin. Wife had left, took the kid, and he had an open marriage, a big complicated mess. A lot of mental problems, a lot of PTSD, and he was found he had overdosed from heroin. All started off with an injury. We had people that worked at the prison, Hayes State Prison that I worked at in Georgia, getting in car wrecks, getting hooked on pain medicine. Most of the people that I know that were in wrecks, when they get pain medicine, they get hooked. They get wisdom teeth out and they get Oxy for 4 days, 5 days, they get hooked. They go like, hey, I just love this. I love this happy feel. I love this pain-free, this euphoria, and they're hooked. And I'm telling you, folks, it's not the way to go. Yeah, it is terrible. Thanks, Tim. So my wife, as I explained, when she had COVID, she's been defibrillated twice. She died twice, and she's come back. She only got 7 more lives. I'm praying, please, Lord, she's 52. Can we stretch out these 7 lives? Because she used 2 of them up in 4 years. Wow. I got to keep an eye on this one over here. But, yeah, I'm funny. You know, I'm not funny. I'm not a comedian, but I try. And it's my husbandly duty because when somebody's in so much pain, you got to help.
If they want an example on...
Yeah, just speak up a little bit so you can hear.
You can repeat me.
Okay.
If they want an example on how bad a CRPS is, they can look up the McGill Pain Scale.
She's saying, if you want to know, you can look up the McGill Pain Scale, which identifies levels.
I'll show you.
She's going to pull it up here, and then she'll get it pulled up, and I'll turn the camera. You can see it. It talks about broken bones. It talks about surgery. It talks about cancer, different types of physical injury, and they give it a scale on a 1 to 50, what the level of pain is. And complex regional pain, the CRPS, is the top, number 1 on this scale. So we get through this. We're going through this lawsuit. They've shut the ketamine down. We're looking, no ketamine. Calling all over the place. You know, when she started ketamine, there's only 3 doctors that did it. The doctor in Ohio that she saw, the doctor at Dr. Shaw at Shepherd Center did it, a 3rd doctor in Tampa, Florida, and he was a non-insurance. Now, her insurance paid for these. He did a non-insurance version, and I heard this directly from doctors. I won't say who or which, but his was, you pay so much money, I think it's $5,000 or $10,000. It's 4 days in a row, 4 hours each day of this ketamine. So you stay down there, he does the IV. Now, when she was doing it, you go into like the PACU unit, you know, put the gown on, everything. Kitty, come on, get away from my lights. And then they give this infusion. It takes about 6 hours. It's going through. And then when it stops, that recovery, 2 to 3 minutes, she's having a normal conversation. She's awake and normal, not like a surgery. But then she's got to have this nausea and this anxiety recovery before they let her get up. You know, she's off balance and stuff. Okay, here's the McGill Pain Scale. I'm going to get over here and flip around for this. And then when you take that away, and now she's got no tramadol and no tramadol patch, fentanyl patch, nothing but Tylenol. Then now all of a sudden it's just pain. So let me flip on this here and you can see this stuff. Let me back up here a little bit so I can see over here. Okay, sprain is up here around 12. Tooth fracture, arthritis, 19 to 20. after shingles nerve pain 21, non-terminal cancer, chronic back pain are up around the 25s. I can't pronounce that word. Ankylosis spondylitis, fibromyalgia 30, childbirth around 35, childbirth with no training around 40, CRPS amputation. It's right there, the 40, right there and above, up in the red. But that's a McGill pain scale, pain index they call it. We got a cat over here that's knocking this equipment off. I'm set up over here. Shady, he only took the cash. Yeah. So we go through this lawsuit for several years. And this is, you know how they explain, the lawyers get on TV. Oh, you got pain. You're in a car wreck or whatever. We don't get paid if you don't get paid. Well, he demanded, we had to pay like $12,000 up front. And by the way, being a police, I had great documentation, and it was like a big case. I handed this lawyer this stuff, everything, outline, photos. It was presented, I was building this to present to a jury. So he still wants all this information. We give him this money, then we're going to settle. We go to mediation, we don't settle, we don't have mediation. Then we go to mediation, then we don't go. Then we end up, in mediation, and they're like, well, the two guys for this one group, let's settle for them because they only did the shots and the cryoablation. The one who did the surgery that really did it, that really set it off and was told by a pain management not to do surgery, and he did, we'll go after him. We'll use them against him. Mm-hmm. So she settles with these two for a small amount to go against the other. And he gets these personal injury cases, they get 40%. So he gets his 40%. The judge awards him extra expenses. These guys golf together. They're in cahoots together. I'd say they're sleeping together, but, we don't want to bring Diddy into this and, any kind of, body lube. I say that sarcastically, but I'm being serious. Because how does somebody settle for $75,000 and end up with $22,000? That's more than 40%. That's a ripoff. That's highway robbery. So then he turns around and he says, I'm going to need $20,000 to go after the other doctor. And like, you just got all this money. Well, I'm going to need this money. So, when we're settling this, we're actually in Georgia, and I have to drive back to Kentucky. We settled. So then it's ordered. He said, filed a motion. He's going to have this dismissed if I don't present other attorney. So I drive all the way up here, go to court, tell the judge who knows me. He was a prosecutor when I was a police officer. When I was doing all these drug cases, he's one of the prosecutors that was on my side. We worked like this, putting people in jail for drugs, meth labs, all the drug stuff that I was finding. And he is like, okay, Mr. Larson, you retired, you was an officer of the court. That's what they would say, the police up here. Because I worked and I was in the court indirectly, but as police. Okay, well, we're going to give you some time. We're going to give you 30 days. Your Honor, I need more than 30 days. It's going to take me 2 or 3 weeks to get an appointment. Well, we're going to have this hearing in 30 days, and then I want to know if you've made any contact. So I don't have a choice. So I call and I make some things, and I talk to a couple attorneys I know and from police work, and the one agrees to meet with me. So sit down. And I get an appointment. I get proof that I had an appointment. I go back to court. He says, okay, I'll set this again for 30 days. We'll see. He needs to come in and present, give us some written argument. I'm talking to this attorney on the phone. He's been a friend. I've known him. He's kind of going out of his way. And he's like, look, I can't get involved. This is already settled with these guys that's doing this. I can't take on another case. We've examined this, my partner and I. And we just can't jump in the middle of this. It's like, for you, it's like fourth quarter Super Bowl at the 2-minute warning because you're just that far deep in this case. So I go back to court, make another trip back to court a month later and tell him, hey, I don't have anybody else. He can't do this, whatever. The judge looks at me and he says, okay, I'm dismissing this. So he dismisses this against this MF and this doctor, podiatrist, who claimed to be the Bengals podiatrist that did this illegal surgery, caused a foot drop, blew this nerve disease up, 96 illegal physical therapy visits, and the judge plays the lawyer's side and dumps this case right out of the water in our face.
Yep.
So let's talk about pain management. Pain management involves pitiful people in the medical field, in the legal field, in the court system. Yes, it does. And I've been a police officer, and I'm supposed to believe in the court. I always tell people, let the courts do it. Don't go get revenge. No, I didn't go get revenge. But you believe in the court system. Court system failed her miserably, didn't it?
Yes.
She's over shaking her head like, got that look. Oh.
So we know.
That's pain management. That's pain management. I can't tell you, we had 3 or 4 doctors. Oh, let's just put a spine stimulator in there. That'll control the pain. That'll take some stuff away. No. You know, she's had migraines, pain pump. She's had migraines through this. And they tried some different medication, failed. That's went on for years.
Mm-hmm.
Let's throw a little success in here. Let's give a little thumbs up because I don't want to be always just negative. She does go get to a neurologist, does a couple pain medicines that don't work. Okay, you qualify for Botox for migraine. Right up in here back to the little nerves that help with the headaches, migraines. So she's been doing that about 3 years, every 91 days, and it actually helps. And she takes that Nurtec
ODT.
Nurtec ODT. I'll type this in here for you. And hold on a second here, folks. Let me tell you this. Cat bumped everything and I had technical difficulty. Nurtec ODT. So, yeah, it seems like the law doesn't protect the good people.
No, it doesn't.
Absolutely. We kind of feel like that, Tim. And it just, I don't know. The story just keeps going here. So anybody having migraines, if you get the insurance pays like $3,300. I got a $25 copay. It helps her with the migraines. And the Nurtec ODT, she may take it every now and then, maybe once or twice a month, just for breakthrough if it's just extreme bad. It really does help. That really does help. So we don't want to give a thumbs up here on a pain medication. What else can we talk about with pain management here?
The trust issues. Because everybody always thinks because...
The trust.
Yeah.
Yeah, they have advertisements. They put medicine on here all the time. Here's this medicine. Here's that. You look them up. Now, my wife, she's one of those, before she goes to a doctor, she reads the reviews. You better have 4.8 stars or she ain't coming to you. I'll put it that way. You better have some good-ass reviews. And if she goes there and doesn't like your bedside manner, she gone to another one.
Yep.
And here locally, Cincinnati, we're like, okay, so they stop all this ketamine. Well, we find this guy, and coincidentally, we know him in the pain management because he did a fellowship with Dr. Hayek up in Cleveland when she was doing these monthly ketamines. So here we go to see this guy, Dr. Sachdeva.
Oh my God.
For some reason, I don't know how I remember his name, Sachdeva.
Because he's an idiot.
We go up there to see him. He does do ketamine. We're like, great, we got somebody who can continue, and it's a short drive. We go up to see him. He reads her chart, looks at her, the foot drop, he had this. Yes, Dr. Hayek's done this and everything. Well, I do ketamine, yes. And he wants to do the spinal stimulator. No. Okay, Sean, well, you know what? You're too complicated for me. I can't see you. Goodbye. And he walked his happy ass out the door. He said, you're too complicated, and walked out. Here's a doctor that could have done this ketamine, who's done this when he did a fellow He was blessed to be one of the like 8 fellows that Dr. Hayek would take on each year, 7 or 8. Trained with one of the top. Now, Dr. Hayek, you know, he would joke with us. He was like, hey, Sean, I bought a house and I'm doing some renovations in my house, downtown Cleveland, historical area. Oh, you know, my wife, you know, and she'd been to him for several years. She's like, hey, Doc, how much did you pay for the house? Well, I can't tell you that. But his renovations cost $2 million. I mean, he's top-notch doctor. We really like him. He just didn't have a staff to help us. He had to stop. But anyhow, it was great. We thought connecting with him. Another one of his fellows does the ketamine up there, east of Cleveland. But he's like, oh, no, I can't take her insurance. Can we call him Bill? Oh, it's not on my list. That's what the lady said when I called. I said, he was a fellow. We know him. He was a fellow with Dr. Hayek. Oh, no. No, we only take these insurances, no more, no less. I'm like, you got to be kidding me. So we got a doctor, won't take our insurance, won't even try. Pitiful staff, apparently. And another doctor that's, you're too complicated. So that's trust issues. So for those that, you know, just joining, we're talking about success and failures of pain management. So we've had kind of one success story here
Yep.
with the migraine. So here we go, moving on. Here's our next step. Here's our next adventure with ketamine. So we get nobody. We you know, Hollywood, Beverly Hills, there's ketamine in California, ketamine in Florida. We're skeptical about it because some of them aren't met, the insurance won't pay. And it's out of network for what we've got because we're here. That's the problem. You know, I'm retired police. My insurance came through state of Kentucky. And so it kind of limits us, you know, geographically. So we call the insurance. This is what we're doing. You know, you've been paying this much for these treatments. Well, they said, well, here, you can go down to Louisville and go to this place. So we go to this place to do this ketamine infusion. It's not the all day. It's a shorter, it's a smaller dose, but it's something. So we go down there and we get in the office and nobody tells us, you know, we're expecting a copay. And they say, you got to go down and do a visit. You got to see if you qualify, go over your charts, go over everything. And then we'll do this ketamine. She shows up and all of a sudden, you got to pay $100 out of pocket for this first visit. Well, we kind of knew that one. We show up for the ketamine. We're thinking we're going to pay, you know, our $25 copay. Oh, no, you know, it's going to be $400. It was $395 for the first one. And the second one, then it was $595. And you got to pay out of pocket. They said, oh, but we give you this itemized form. You send it to insurance. Okay, so we get this itemized form, send it to insurance. You got a wrong code. Well, and to get this going, it takes 7 visits to get this in started, and then you would do it monthly to get these small doses and built up to make sure you're okay. She gets through these visits, goes back to see the I guess it's a PA for psychology or whatever to deal with this anesthesia psychology. Okay, you're approved. So all this is out of pocket. We're billing insurance, they're denying it. We're billing insurance, they're denying it. This code is expired. Can you help talk me through it? Nope. You got to just do this. Here's the form. Here's this. Nobody in this insurance would help us do this. I'm like, you got to be kidding me. I've submitted this 7 times. I'm still submitting. I'm still fighting. I got to call tomorrow to find and check on this claim again. Because they keep changing this. Oh, this is this. This is that. Oh, you did this wrong. This number's wrong. It's outdated. It's outdated. Come on with the outdated stuff, people. I can't handle this being outdated like this. So these are these places, you'll see them all the time, that if you've got depression or PTSD, though, you pay out of pocket, and they say it helps. Well, I go to see Mayfield Brain and Spine for something else other related, and they said, oh, ganglion blocks work for PTSD. Well, I don't know. I haven't talked about it. I haven't gone into that. What's helping me for PTSD is praying, faith, and believing in God, and listening and believing in my wife. I'm pointing to my wife right here. It's a money racket. It is, Tim. And you know what I saw last week, and I screenshotted it, but I'm not showing. That this ketamine for depression and PTSD has become $1 billion a year industry. And this place that she was going to, it shut down. It probably opened in a different name. The place that she found up in Dayton, Ohio, and went and did 3 or 4 treatments, and he shut down. And partly because of Matthew Perry and all of this ketamine stuff and the ketamine queen and the stuff in California. Now all these doctors are not doing it for pain management. They're only doing this for out-of-pocket, no insurance, and it's a $1 billion scheme. Gee, I wish I had PA or, nurse practitioner behind my name, and I could go do these infusions and put some stuff in the IV and watch their heart. You're giving them a low dose. People aren't having problems for this, and you charge them, and they just pay you cash up front. So you're getting paid every day. You don't have to go home and say, I billed it, and I wonder how long insurance are going to pay me. No, at the end of the week, you're supposed to have $18,000. You got $18,000. There's no insurance paying it. It's all paid up front. Yeah, it is a racket. So now again, we have no pain management. She's in some CRPS groups. And some of the people, and I told you this is called the suicide disease. Let me tell you how bad this is. Last year, 2024, 2024, also 2023 and 2022 and 2021, there was at least one NASCAR driver that committed suicide because of this nerve disease. NASCAR is not exactly a safe sport. They're reckoning getting some serious injuries, and with this injury comes serious pain. Serious pain. Hi, welcome, Jennifer. Talking about pain management, good and bad. If you've got a story, a doctor's story, and I've kind of walked through her foot surgery, her nerve disease, 15 years of this is bad. Share a story. Anything that's been good and bad. If you look in the notes, I put in Nurtec ODT. That, everybody, along with every 91 days Botox for migraine, is helping her with migraines. The Nurtec is not every day. It's like for the worst days to help break through. Just to get back to that. So, we have nothing now. People in her nerve group, in her CRPS group, we went to a retreat about 6 years ago up in Pennsylvania. How many in that group that was up there with us? There's couples. You rent out a cabin for like 12 couples. How many people have passed away?
I don't
3 or 4?
Yeah.
3 or 4 of the people that we saw that are going through this committed suicide and have passed. In her group, it's unbelievable. She'll tell me, this person committed suicide. This one has passed. This one has passed. It's terrible, the pain that she goes through. And normally she's on camera with me when I'm doing these podcasts, our painting for PTSD. And anybody that, didn't see, it's my first picture in my efforts to relieve PTSD. It's upside down, I'm sorry. Check it out. First painting. It came with like 8 colors in there, 4 paintbrushes. I looked at a picture and I did it. Kind of had some verbal guidance from her. She's my partner over here. You know what else relieves stress for us, PTSD? I was already police when I met her. She watches, we both watch him. Live PD with Sergeant Sean, Sticks Larkin. Her name's Sean, his name's Sean. We like it, we like him. Sticks. Any police shows and they're tasing people and different things. She loves watching that. Sometimes that's an outlet and release for us. And a release for me for PTSD was for many years, honey, we need to watch a movie with some guns. I got to hear some gunfire. People got to be getting shot. I need some John Wick action going on. It's kind of how I dealt with stress. She dealt with stress in a different way. She dealt with the stress from these injuries through prayer, through faith, and coloring. And she probably has about 512 adult coloring books.
No. I probably have 4. No.
About 30 adult coloring
50.
books. And 50. And she's began to just, she paints some pictures. She does some craft things for our grandkids and kids. And that's their stress relief from pain. And this nerve disease, she got a little bit of shaking. She has to take a medicine for that. But her hands don't shake when she's crafting. And that's like God giving this, that's her talent. And that's putting her in that zone of like, I'm going to bless you to be calm and enjoy what she's doing. And she's doing this.
Yep.
That's a way how she's dealing with pain management. You know, oh, I get dog hair all over me. You can see from my shirt I got some paint marks. That's from us doing some painting around the house, whatever, or touching up or a little something. And we paint and we laugh. When we do stuff like this together, we're always giggling, aren't we?
Absolutely.
Making each other laugh. That's how we deal with the stress. That's how we deal with this. We got some more pain management stuff we can talk about, can't we?
Yeah.
What else can we tell them about pain management?
It sucks.
Besides, it sucks.
I'm looking for some new pain medicine.
Looking for new pain management. Guess what? When you go to pain management, oh, let's see. Have you had the radio frequency ablation? Have you had epidurals? Have you had nerve blocks?
Yes,
And
yes,
then
and
we
yes.
move, and then they want to start with those again. Okay, well, now he did that back then. You know, technology's improved. I'm going to do this too. I don't know how many times they've tried to do this nerve block and everything in her back. Guess what? What was the last thing that you had in your hip that was bad?
I don't know.
Was it the RFI, the radio frequency?
No,
RFA?
no. He gave me one, and I swear it made me come up off the table.
Was it like a epidural for sciatic nerve injection there?
Something like that.
Sciatic nerve area. And she come off that table, her mom was with me, and that was the worst pain. Come home just like not mobile in the house at all. Now, and if you've noticed, well, we got Elvis laying down here on the floor. He's the 18-year-old, the black Chihuahua. White Chihuahua's laying up here by her head. The big dog's laying right over here next to me on this side of the couch. But when she has really bad days like this, they lay really close. We've got some cats. I don't know where. Well, there's one of them over here. Let me come over here and show you. So we got a kitten right there. We got the big dog right there. You've seen him. He's the one who wanted to go outside. And he wants to get on the couch. And then you can see there's a little dude up there. And then you can see, there he is down there. That's Elvis. And he gets glitter on him all the time when she's doing crafts.
And I think he does have glitter on him now.
And I gave him a bath today. Today was dog bath day. Pain management. Pain
Does anybody have any
management.
questions about pain management?
Yeah. Anybody have any questions? You know, and unfortunately, we've had to experience this. We've dealt with this here in Kentucky and in Ohio and Michigan. We lived up there. Down in the Tennessee, Georgia area, we lived down there. She's had the CRPS since 2009, 16-year veteran. Her best friend, Susan, from Ohio, has been actually with Dr. Hayek to Washington, D.C. to present, and had some things passed where doctors have to go through 40 hours of training in this to understand this nerve disease and when to not do surgery, when to not do therapy and mess with it, how to leave it alone. Because the doctors, you know, when you get to doctors, oh, I'm a specialist, I know everything, I know this, I know that.
Yeah.
You know, migraines are pain, right? A lot of people suffer from migraines. And we've heard a lot of stories from people about migraines. We've had a lot of people talk about stuff. I got migraines. You know, I told you we had the big C word, the COVID word bad. She died. They had to shock her in the ICU. I was at home. And, you know, let me tell you something. When you're on FaceTime, like I'm looking at myself right here, and you know how FaceTime they're there. And she was in the ICU for 11 days. And every phone call I had, I felt like I needed to call her every 15 minutes, but I wanted her to rest. But I was scared to death that every phone call was going to be my last call. Because we both lost a bunch of weight. We both looked terrible. I looked at her and I was like, you know, I'm the police and I've seen a lot of people die. People have died in my arms. I've done CPR and I've watched people looking and talking and go like this to go like this to go like, and they're died right there. And I'm looking at her like praying, please. And then I got a little bit better and I would take the kids and drive to the hospital. And, you know, it's in the wintertime, it's in December. And I'm staying outside in the freezing cold looking up in the window at her on FaceTime. And she's crying and I'm crying and she's looking out the window and we're waving like, She's on the third floor. Like if I could only get my hand up on the third floor and touch that glass and, you know, my hand to touch her hand, couldn't go see her. That's scary. That was scary to think that we both could have almost, you know, not come out of this. And so that's 5 years ago. So our kids were like 14 and 12.
Yeah.
Yeah. Do you need anything? No. Okay. Ask me if I need anything. And they didn't know to look at me. They didn't know any better. I mean, my second time to the emergency room, her mom's looking at me on FaceTime like, you look bad. You need to go. So I get in the car and go drive myself to the hospital. She's going to come take me. I'm like already in the car and off to the hospital, emergency room. And then I'm staying there and like, I call her, hey, I'm in the hospital. They say I'm pretty bad. What do you mean I'm pretty bad? And I'm just laying there, and then I tell her, hey, I think I'm doing better now. I'm a little more coherent, and they said my organs were failing, but I feel okay. I don't feel anything wrong down there. Gee, you don't know what you're saying when you got bad fever and you're in COVID. You're delirious.
We were delirious.
When we first got it, this is hilarious. We spent 4 days looking at each other in bed, sweating the sheets out with 104-degree fever, thinking who could get the highest fever. It was like Cheech and Chong in there. We were hilarious. We were just goofy people. I get up and go down here, like in the kitchen. Hey, what did I come to the kitchen for? And I'm like, could barely walk. Fell down the stairs a couple times. Get back up. You okay? Oh, yeah. I fell down the stairs, honey. Can you believe that? But I got you some water. And then we're trying to eat chicken, trying to eat grilled cheese, trying to eat. Throwing up, making us sick, not eating. Losing weight, getting pitiful. Gee, now they tell us we're diagnosed with long-term COVID symptoms. And our daughter, who works in the urgent care, sent us an email here a few minutes ago. She showed me, you know, now that we have a different president and are not doing all this scare tactics or this hide stuff that come out, all these symptoms. I'm dealing with headache, all kind of stuff going on. Pain. Here's the pain management. I go to the doctor that's doing her treatment. I didn't tell you his name on purpose. That's doing her Botox because it's working for her. They give me Depakote, generic Depakote. I'm hallucinating like I'm a werewolf pulling my skin off. I call and scream for her one day. I'm in the middle of the bed under the covers like this. I'm yelling and telling her I fell down. I'm under the bed and I'm stuck and I can't get out. And she's looking at me and looking under the bed like, what do you mean you're stuck under the bed? Who's under the bed? We got pets. She thinks some pets is stuck under the bed. And I'm swearing it's me upside down in the corner underneath the bed. But I'm just laying under the blanket like this. And they give me another medicine, I hallucinate. Give me another medicine, then I feel like I'm falling out of the sky. So then they give me the Botox for migraine. And he gave me 4 shots, and he's like, what do you think? I was like, ooh, I like it. You know, I taught self-defense, I like pain. He gives these all through my head. I'm like, man, that was really cool. An hour later, I'm like, ooh, I'm nauseous. That sucks. I better lay down. Didn't do anything for my migraines. You know what it did? That and what was I taking? Cymbalta. Between the two of them, guess what number 20 on the side effect list is? Here's pain management problems. And you see these things on TV. You know, Jardiance is I hate the Jardiance commercial and dance, everything. They gave it to her. Caused her problems. It talks about how it can cause problems, this and all these things, and redness and rashes and genital problems and pain and everything. Guess what item number 20 is on Botox for migraine? If you have prior urinary tract issues or problems, and I did with COVID. When I had COVID, it would burn when I peed, but I never had a urinary tract infection. That's how I knew I had it 5 times. That and the Cymbalta together exaggerated. I could not feel my genitals. I didn't know if I was peeing or not. And here I'm in the emergency room with migraine. I'm like, hey, my hands are burning. They're on fire. They're numb and tingly. And I can't feel if I'm peeing or not. And the doctors are freaking out.
Yeah.
Pain management. Guess what? No Botox, none of that for my head. Then I had a test, and then they said, oh, we need to do a spinal tap. Make sure your flow's right. Yeah, I'm dripping 15. Great. Now they're testing me for a spinal leak. Go to do a test, it didn't get up in the upper sac. Starts with a T, I forget the word. I go back and do it again, still didn't reach that upper sac. The thoracic sac or something, I don't know. Still didn't reach it. I have to do the test a third time. That made me sick for about 5 days because I had to be upside down and get all that dye on my head, that myelogram dye. Still testing for this stuff. Pain management, they got a plan. Either I'm leaking and I'm not. If I'm not leaking, then there's a plan to go next. So at least there's a plan. Pain management.
And if people don't know what other people's pain is, they shouldn't be so judgmental.
Yes. Judgment. Judgment-free zone. How often do you say you're in pain and people are like, you don't look like you're in pain. You're out here walking around. Look, you smiled today. You can't be in pain. Oh, gee, Sean, you look pretty. You fixed your hair. You got lipstick on, a little bit of makeup. You put a dress on. You look pretty. You look beautiful. You're happy today. How can you be in pain today, Sean? Makeup doesn't take pain away, folks. But I think one of you knows that. Smiles don't take pain away. Smiles help you to get through the day. Here's the truth about pain management and chronic pain. I made some exercise videos on my YouTube channel, you know. And I started off exercise, and I started off doing a segment where I was in a wheelchair trying to do some upper body stuff for people. I made about 5 exercises videos, and I quit. And I go inside, and I got tears rolling down my face. She's like, what's the matter? Did you hurt yourself? And I was like, I feel guilty because I'm not in a wheelchair and I can move around, and I feel guilty sitting in this wheelchair pretending to do exercise to help people. It could help people. It's very basic stuff. But I felt guilty because I got up out of that chair and I walked away. And every video, I would get up out of the chair and walk away or stand up. And then I go make a video the next day and I'm doing squats and deadlifts talking about something else. And then in the back of my mind, I'm like, but she's been in a wheelchair. She got a power wheelchair. She had foot drops. She can't run. She can't walk. And I'm like, what do I do? I just couldn't do it. I felt guilty and I had to stop. I went to spine surgery because of her and her faith. And this word right here, my belief and faith in God and her. You see her foot right there and some toenails. I didn't do any pain medicine and it hurt. Yeah, spine surgery wasn't the greatest, but it wasn't the worst. I had her and I got through it. Still got some issues, some things are changing, things are up here. We're just dealing with it. But we're very, very experienced in the wrong pain management, aren't we?
Oh, yes.
We're not afraid to say no to the doctor. We're not afraid to just, She refused. They still want to do a spinal stimulator cord in her. After all this going on these years, let's stick it. I'm just like, let's see, scratch my ear. Nope. Nothing in there. No money coming out. No magic answer coming out. And definitely no idea of stimulator to go in her back.
Mm-hmm.
You know, folks, this has become very complicated.
Yes, I have.
Very complicated process dealing with pain management. It is very individualized and very specialized to everybody that's dealing with pain. And I know there's a lot more people that have pain management problems than is joined on here tonight. And I'll post this around and hopefully we'll get some people to watch it. Give me some ideas, folks. You know, my podcast, it's to help people with PTSD. And in the very beginning when I introduced it, and it's 9:13, and here's something else going on. Here's something else with pain that affects me. What happens at nighttime when we're sitting and watching TV?
You fall asleep.
I'm talking, all of a sudden I'm just like, and I was passing out. I passed out in the movie, like, and I'm not just falling asleep. I'm waking up like, oh, honey, that was a great nap. I feel so good. That's not how it is. I wake up and my body's tense and my fingers are clenched. I had to have a trigger finger surgery in this thumb already because it swelled up and it was like just sticking out and in a way painful. You know, I've had the EMG. I don't have carpal tunnel, But these two fingers are locking up, clicking really bad. And it's something coming from up here, compression or up here. Trying to figure this out. Pain management. Doctors, lawyers. It comes from car wrecks. It comes from surgeries. Surgeries are half the reason people get CRPS, complex regional pain syndrome. Surgeries. Injuries. It's not hereditary.
No.
And statistically, it's like 51% female get it, 49% male get it. So it's not just dominant, it's not just leaning towards, women get it, men get it. And it usually comes on with people between 17 and 35. It's weird that age, that's when people tend to get it, that adult part of life. Can't figure that out. What's it related to? We don't know. Why is it most commonly shows up between 17 and 35? That's a mystery, but it does. About 33% of people that get complex regional pain syndrome, CRPS, end up full body. That means the other 67%, it just gets, for instance, one of the guys that came to that retreat when we went in Pennsylvania, he was a carpenter. Hit himself in the hand a couple times, and everybody that's nailing hits their fingers, and they cuss. Hit his hand one time, and really quickly, his hand all of a sudden changed. Started burning, started turning purple, swelling. And he was like, the only thing that's happened is hitting my hand with the hammer. He's not with us anymore. It got up in from his wrist and his arm a little bit. The pain became too much for him. Pain management, problem with the pain, the doctors, the lawyers, I keep saying this, you got to have a great spouse, a great partner, a great person to stay with you. I stayed with her. She stayed with me through everything. And the things with me haven't been physical like that. It's been different, with police and death and, it's just been, hers has been the difference. So it's the opposites. And we've been able to help each other.
Yeah.
But a lot of people that in the CRPS groups, they don't have that spouse. They lose that person and they end up not staying together. And then all of a sudden the person becomes alone and then they have no support. They have nobody, no faith, nothing to believe in. And the pain overwhelms them and then they make that ultimate choice and they take their life. His name was Eric, wasn't it?
No. No, I still have it. I still talk to Eric.
Okay, still have Eric. I wanted to think it was Eric. I can't remember the name.
I don't remember either. I have a horrible memory.
Pain affects memory, short-term, long-term. Pain affects speech. Pain affects your sleep. Me falling asleep, I have trouble sleeping. It's only 9 o'clock. I don't know why, I'm just yawning, I'm sorry. She has insomnia, terrible. They want to give her tizanidine, Xanaflax, give her trazodone to try and get her to go to sleep. Boy, she takes that stuff. She don't go to sleep till she's ready to sleep. It has nothing to do with the medicine. So we normally go to sleep around 2 o'clock to 2:30 in the morning. Usually we're watching the live PD at 2 o'clock in the morning, 1 o'clock in the morning. People are foot chases and yelling and people getting arrested and drunk people come out of their house falling on the ground, funny stuff. And she's like, I'm like, honey, if you watch these PD shows, the police shows, or Chicago PD, you get worked up and you don't want to go to sleep. But it's what she has to do. It's her therapy. It's how she rolls, as we say. And then we go to sleep and then we get up. So our sleep is different, our eating is different, our nausea is different. One of the things to help deal with pain management is you got to have Zofran. You have to have dissolvable Zofran to pop under your tongue for those bad days.
Yeah.
You're going to need some acid reflux because where nausea comes, acid reflux comes. So you're going to start all of a sudden being on 3 or 4 medications, something to help you go to sleep. That's the issue with pain management. Here's another thing. They said temperatures drop. When you're in severe pain, guess what? You can't go outside in the cold, in the snow, can you?
No, because I only wear sandals.
She can't wear a shoe because of his foot drop. She wears slides. She wears slides. So with pain, when you're in extreme pain, you don't go outside when it's 100 degrees in the heat and you start sweating. That just throws your body way out of whack. Going outside when it's really cold, out of whack. How about the hours before rain happens? You feel the rain, you feel the pressure, the head migraine from your head and down into your body.
Yeah.
Bones hurt, muscles hurt. The weather really affects pain. You go to the doctor and doctor's like, oh, wait a minute, I need a urine sample before I can talk to you. And here you're sitting in there, shaking, you're in extreme pain, migraine. This weather's killing you. You're sitting and people going like this because they're in pain. They can't sit still and their eyes are like this and the doctor's like, okay, you passed your urine and you're not taking any illegal substance. That's great. Thank you, folks, for not doing that. Okay, I'm going to prescribe you something that's a little bit addictive, but it's going to be for a short period, and then we're going to transition to something else, and then we're going to do this. Okay, and then here's the word that you hear. It's not believe, it's experiment. How many times in pain management do you become an experiment, or do you feel like a guinea pig?
Yes.
From the very beginning when this started, if you go back to the very first 10 minutes of this podcast, and I started talking about the doctors and the shots in her foot, you know, and this tendonitis that turned into plantar fascia. She became an experiment. Guess why? That cryoablation, remember I talked about that cryoablation? Oh, okay, so we gave you 13 shots in 11 weeks. That didn't help. Let's do this cryoablation. It's like this pencil. This little thing that'll go in, it'll freeze it, it'll numb it, and then it's gonna calm it down. Guess what? When they did that, I was looking at our insurance bill. I'm trying to find out, why does this guy want to do this stuff? And he says, we only do it on Fridays. And I looked, and it takes 15 minutes to do it. They go in, they spray something, they numb it up. It was like, you know, they spray that cold stuff on there, maybe give you a shot and numb it up. And then they did that cryoablation and put a Band-Aid. You know, it's 15 minutes to do it. She was back there a half an hour because the nurse had to help prep and everything. Just take your sock and shoe off, scrub your foot up, you know, and then she was ready to go. But the doctor was only 15 minutes. So he's doing 4 an hour, and he's doing 8 hours worth of these things. 4 an hour. So I calculated this 6 hours a day he's doing this, not 8. Give him a chance to take a lunch break and to goof off, type some notes, do some dictations. Okay. So 4 an hour times 6 is 24. Our insurance was billed, and our insurance agreed to, and paid him $1,600. The bill was for like $3,000 for this procedure. So if he's billing insurance and he's getting $1,600, $1,600 times 4, 32, $6,400 an hour. $6,400 an hour times 6 hours. $36,000. $36,000 times 50 weeks out of the year, because he's on vacation 2 weeks a year at least. He's going to miss 2 Fridays. But if he's smart, he'll always be there on Friday and be gone Saturday to Thursday. He's got to be on his money day. So if this doctor, this podiatrist, his $36,000 per Friday times 50. Let's see. Let's see if I can pull up a calculator here. Hey, honey, you got a calculator handy?
I do.
Oh, I got to update on my computer, so I can't find the calculator
I got
now.
one right here. It's on my phone.
Right there on your phone. Okay, so we're going to do something really quick. 36,000 times 50. 50 weeks. You know what, folks? You know how much money that is? $1,800,000. $1,800,000. I'm going to put this right there. See it? I just did that. $36,000 every Friday times 50. $1,800,000, 800,000 to the practice. Here's why this is important. He billed people. Let me turn around.
Great.
His office visit, say $125 is what he billed insurance, because he's a podiatrist. He's not like a super specialist. $125. So let's say 6 hours times 4 is 24 patients. 125 times 24 equals $3,000 a day times 4 days a week, because the 5th day, member, is his procedure, $12,000. So he's making $12,000 a week office practice times 50. Okay. Here's the thing, folks. See right here, $600,000. So that doctor, there's 2 doctors in the practice. 600,000 times 2 is 1.2 million. So the 600,000 times 2. So they make 1.2 million. But if they do these procedures, they make 1.8 million on top of it. So now all of a sudden their office practice is worth $3 million a year. That's how these 2 podiatrists are making their money. But only the one's certified, so he makes more money. The other guy's going to go get his 15-minute certification, which really wasn't going to get it, because you know what it was? Because she asked him, "Oh, do you have to go to class or training?" "Oh no, the guy brought the machine over and he showed me how to use it. So now I'm certified podiatrist on doing cryoablation and sticking it in your foot. 15 minutes. Oh yeah. And guess what? After he did this and she ran into him in Kroger's grocery parking lot 2 weeks later. "Hey, how you doing?" "Oh, I'm not doing so good." He dismissed her too. She said, "My foot hurts, it's swelling. I can't hardly walk on it." He's looking at her. "You were in a wheelchair, weren't you?"
Yep.
She tried to make an appointment, and what did the nurse say? "Oh, he doesn't need to see you anymore.
Yep.
You're fine." I do have that picture and I can send it to her later, but I can't right now. So that's pain management at its finest. You know, we've been talking for about 86 minutes. I won't talk all night long. I could. We could talk. We could bring this out because it just gets much deeper. But that's just a good example of pain management. We did say one positive, one plus, about the Botox and the Nurtec ODT. But there's so much going on that's not good. People, shop your doctor, get your knowledge, get your information. Really research, read and research. Everything is on the internet. Google this. Figure out what's going on, what they're telling you. Look at the symptoms.
The medication.
And the medication. Nothing wrong with going in and telling a doctor. And if you try and tell a doctor, "Hey, you know, I read about this, I'm concerned about this, I'm worried about it," it's your body. If you don't, they're going to screw you up. They're just going to have their way because, you know, they do get bonuses. You know about that big pharma stuff. They do get bonuses to push medications on certain things. Know your medicine, know your treatments, know what's going on with you. Put yourself as a priority to the doctor. And don't be afraid to fire a doctor or say no or quit and go to get another opinion or a third opinion. Don't be afraid to go get an attorney when these doctors are taking advantage of you. And you know, and here's what they say, like with a malpractice, you have 1 year. Normally the states are 1 year, occasionally 2. But it's from the time that you should have known that something's wrong, which means that you have to go back, and when you can prove from a doctor, an attorney, or from a source that somebody did something in medical malpractice, you have 1 year from that date that you figure out and the light bulb goes out and you're told to file that lawsuit. Even if it's 3 years after you're injured, you find out, then that's when you file. You have to be the responsible one for your pain management. That's, I guess, what we're trying to say. She has been through chaos. Do you have your other foot up here? Can you switch and put your other foot up here? Can I show your foot in this scar? Let's talk about pain management, folks. Before we get done, this is the surgery. No, I can't turn it. This is the surgery right here. When they cut this tendon back here. All the scar all the way up here. Let's see me back up. All the way up to right there. You know, it took a year for this open wound. We had to do major wound care. It took a year for that to open up. Thank you, honey. She has endured ungodly amount of pain. Still in a lot of pain. That's why she's not on, her face is not on tonight like normal. That's why she's not painting or crafting. We're not doing that like normal. Take it in your own hands. Take charge. It is your life. It is your pain, right? And it is your future.
Absolutely.
Thanks for joining here. Don't forget to subscribe. There's a lot of things that cause PTSD. We may talk in the near future. The night we went and picked our daughter up, and I talked a little bit about it once myself, but she was really helped her when we got the call, come get me, from her boyfriend's house, and what she saw and what was happening. Thank you, Tim, for staying with me. You have a good week. Be safe down there. Tim, corrections down in Georgia. I was to correction in Georgia. Got to be safe. Got to be safe. Tim, I just saw that they arrested a former Hayes correction officer. He was only there for about maybe 2 months. Lied and said, now if you look at a picture of this dude, you would know he was never in the military, because he doesn't have that look. He's not been through boot camp. He's not been force marched. This dude hasn't done 2 push-ups in his whole life combined. No way he went through the military. But he lied about that, and he came in. He was connected with somebody. His whole sole intention was to introduce contraband, and he got caught really quick. But he's another Hayes tragedy. But have a good night, Tim. Thanks. Be safe, safe, safe. Safe to everybody. Don't forget, every Thursday night, 8 p.m. Eastern Standard Time, we're talking about PTSD. You know, we do know people. We do have people in our family that's been sexually assaulted that have PTSD. You saw that too, yes.
Everything.
Car accidents, the injuries from that. You know, and it's sad when your children tell you they want to hang themselves in a closet. We've talked a little bit about that. But her and I in faith, a lot of prayer and a lot of crying have got us through this, haven't it?
Absolutely.
We've got friends that have lost their lives to overdose and to suicide. That's the reason we do this podcast. We're helping people. See you next week, 8 o'clock.